Ladies and gentlemen, happy Ramadan. Today we'll discuss an important subject, gallbladder disease, gallbladder stone and fasting Ramadan. As regards the gallbladder disease, there are many presentations for gallbladder disease. First as acute cholecystitis, second as chronic cholecystitis, and third as a gallstone. As regards acute cholecystitis, and this is considered as one type of inflammation. Acute cholecystitis is common in female, in fatty female, in young age or middle age. A patient may suffer from sudden acute pain in the right side of the abdomen with nausea and vomiting. Pain may be severe and sometimes radiate to the back, and so patient may suffer from severe agonizing pain lead to complication, as we'll discuss. As regards the diagnosis of acute cholecystitis, can be diagnosed acute cholecystitis by clinical examination and also by abdominal ultrasonography. You can see the gallbladder distended, inflamed with the sequole, oedematous wall, and the abdominal ultrasonography is now considered as one of the important diagnostic methods for acute cholecystitis. A patient with acute cholecystitis cannot fast in Ramadan at all because patients suffer from severe agonizing pain and vomiting, nausea, and pain may be radiated to the back. Also, acute cholecystitis may follow by complication like formation of pus inside the gallbladder, perforation, or element of liver affection. So patient with acute cholecystitis should be admitted to hospital, will be considered for surgical treatment mostly. Can be start medical treatment as first, then followed by surgical treatment. So this patient, whatever under medical treatment or surgical treatment, cannot be fasting Ramadan and should be stopped fasting at all. As a large patient with chronic cholecystitis may be complication for acute cholecystitis. Also may be from the start the patient may be present as a chronic cholecystitis. Also chronic cholecystitis is more common in female, middle-aged female. Patients with chronic cholecystitis usually suffer from chronic dyspepsia, especially dyspepsia to fatty meal, like nausea, vomiting, gastric pain, pain in the right hypochondria, maybe distension following especially fatty meal. Also patient may suffer from vomiting, severe vomiting after fatty meal. This patient with chronic cholecystitis also can be diagnosed by using of abdominal ultrasonography, and this condition of chronic cholecystitis, the diagnosis may be need to measure the gallbladder during fasting and gallbladder after meal to see the size of contraction of gallbladder and the size of decrease in the size of gallbladder between the fasting state and after meal state. Patient with chronic cholecystitis can be considered into two categories: mild patient, a mild attack of cholecystitis. Mild attack of cholecystitis like some sort of dyspepsia, nausea, some sort of dyspepsia to fatty meal. This patient can fast in Ramadan and should be avoid to start the meal with a heavy meal, with fatty meal, and should be avoid irritant food. A patient with chronic cholecystitis type 2 with severe presentation and severe dyspepsia, patients suffer from frequent nausea, frequent vomiting, severe pain in the right hypochondrium, even in absence of fatty meals. This patient with chronic cholecystitis and with severe dyspepsia, I think this patient not fit for fasting Ramadan and should be to take a frequent meal, small meal, avoid fatty meal in this condition. As regards the gallbladder stone, gallbladder stone may be cholesterol stone, may be mixed stone. Also gallbladder stone in Egypt, there is an important cause is the chronic liver disease. Chronic liver disease, in about 25% of chronic liver disease may be presented by gallbladder stone, and the gallbladder stone is considered secondary to the chronic liver disease. Patient with gallbladder stone may be presented by pain in the right hypochondrium, even sometimes there is severe pain, colicky in nature. Also patients suffer like acute and chronic cholecystitis from dyspepsia, and dyspepsia may be related to fatty meal. Also patient may suffer from complication of gallstone, and this is occur in the patient with a small gallstone. Small gallstone less than half centimeter can pass to the common bile duct and lead to some sort of obstructive jaundice, and this patient will presented by jaundice, yellow coloration of sclera, dark coloration of urine with pain in the right hypochondrium. As regards the gallbladder, whatever presented by dyspepsia, presented by pain, presented by obstructive jaundice, this patient will need investigation to assessment the condition. Also the most important diagnostic subject in this condition of gallbladder stone is abdominal ultrasonography, and abdominal ultrasonography can see the gallbladder, thickness of the wall, number of stones, size of stone, and the diameter of common bile duct, and if there is intra or extrahepatic biliary obstruction as a complication for gallstone. This as regards the diagnosis of this condition. As regards the management of this case, patient with gallstone can be considered into two types. At first, silent gallstone, and patient not suffer from any symptoms or any complication, and this patient also can fasting Ramadan after exclusion of presence of chronic liver disease. A patient with gallbladder stone, but there is many manifestation like frequent pain, colicky pain, or presentation by complication like obstructive jaundice, or in presence of severe dyspepsia. Patient may not fit to fasting Ramadan because frequency of vomiting and nausea and the severity of pain sometimes, and in the presence of complication like obstruction, a patient will not fasting Ramadan, and patient will subjected to take medical treatment at first, and if need in the presence of complication like obstructive jaundice, we need surgical treatment to relieve this element of obstruction. So as regard to gallbladder disease and fasting Ramadan, acute cholecystitis cannot fit at all for fasting Ramadan, and patient should be receive medical treatment and usually followed by surgical treatment. As regard patient with chronic cholecystitis without stone can be classified into two types. If patient with mild presentation can fasting Ramadan and should be avoid at the start of meal to take fatty meal or heavy meal or spicy food. As regard the patient with chronic cholecystitis but with marked symptom, marked manifestation, severe dyspepsia, this patient may not fit to fasting Ramadan and need to take a frequent meal and to take medication. As regard patient with gallstone, may be silent to gallstone, and this need no further management and should be considered as follow-up only. This patient can fasting Ramadan or fasting Ramadan easily. Patient with gallstone but with marked presentation like pain, dyspepsia, this patient is not fasting for Ramadan and should be take frequent meal, and sometimes patient may need to surgical interference in this condition. Thank you. Tomorrow there is a new.